look, there are studies that potentially suggest that, the study out of Mexico is saying that higher levels of ADHD symptoms were found with mothers that had higher levels of fluoride in their urine. There are animal studies that show that higher levels of fluoride also led to some of the symptoms of ADHD. There was a Harvard meta-analysis study looking at 27 studies showing lower IQ with fluoride exposure. So, there are articles out there. It's definitely something to dive deeper in. I'd love to see the science that continue to come into this. But if there are questions around it, and if you're concerned about it, there are absolutely better alternatives out there like hydroxyapatite.
Welcome to the Soaring Child podcast, where parents of children with ADHD learn tips and tricks to help their child soar at home, at school, and in life. We feature interviews with experts, medical professionals, and parents just like you who are learning how to reduce ADHD symptoms using food and other natural strategies. Because children with ADHD deserve to soar just like every other child. I'm Dana Kay, your host. Hello, parents. This is Dana Kay here with another edition of the Soaring Child podcast. Now, today we're diving into a topic that might seem a little bit unexpected, but could completely change how you support your child with ADHD, and that is oral health. Now, I want to tell you something that completely shocked me as a parent after years of struggling with my son's ADHD symptoms, trying every diet change, supplement, and lifestyle tweak that you could just imagine. As I'm sure if you're a regular listener here, you would have known my whole journey. But I thought we had covered everything. But then I learned something so simple, but I think really mind-blowing. I couldn't believe that I'd missed it. The toothpaste that he was using. Yes, the toothpaste, okay? It was full of artificial ingredients that were actually contributing to his hyperactivity. And I really couldn't believe that something as basic as brushing his teeth could be affecting his behavior that much. And that's why I'm so excited about today's guest, who is going to actually deep dive into the connection between oral health and ADHD and ingredients, something that, I wish I had learned years ago. And to help us break it all down, we have an incredible expert with us, Dr. Derek Gatta. And Dr. Gatta is a dentist. He is the co-founder of RiseWell, which is a science-backed oral care brand that is really revolutionizing the industry with its non-toxic dentist-formulated products. And after realizing that most toothpaste on the market contains toxic ingredients, he actually teamed up with his sister and brother-in-law, which is amazing, family business, to really create RiseWell, which uses non-toxic ingredients as that safe and effective alternative. He is the head of science council at RiseWell, and Dr. Gatta leads the search for the healthiest and the cleanest ingredients, really raising that bar of that quality and that purity in oral care. He's not only an expert in the field, but he's really passionate about helping people achieve optimal oral health, which is just so vital for all of our overall well-being, especially for our kiddos with ADHD. So now it's time to welcome Dr. Derek Gatta to the Soaring Child. Hi, Derek. Thanks so much for joining us.
Dana, thank you for having me. Happy to share and speak with your community here.
Well, a fun fact, actually, before we get started, my dad was actually a dentist.
All right.
He's retired now, but I grew up in the dental office, with all those ingredients that are currently in most toothpaste out there. And look, you were traditionally educated at Vanderbilt University and Nova Southeastern University. At what point in your career did you sort of start to realize that many of the products commonly used in dentistry might actually be toxic to our bodies? What sort of sparked that shift in your thinking, and how did it influence, your approach to oral care?
Well, again, thank you for having me, and great question. And I think I've always had a hunch that things like mercury amalgam were probably not the best material to be using in your body. But look, academic institutions, their mission is to produce safe practitioners in the world. They're under pressure to get people to graduate and be safe providers. So I understand their motivations. Good-minded people just trying to do their best. But I think institutions are slow to react to the evidence that's out there now. And also looking at opportunities for health. My sister, she's been very open about some of the health challenges she's had with polycystic ovarian syndrome, and looking at trying to live a more healthy, clean lifestyle. We kind of knew that eating better was priority number one. Get better foods, get rid of the ultra processed foods. But looking at the beauty products and the dermatology products you put on your body and in your mouth, like oral hygiene products, we kind of had a hunch that, hey, we want to live a healthy, clean lifestyle, and we applaud the other companies that are out there in the space. But if you're not brushing with an effective anti-cavity ingredient like fluoride, you may as well just be brushing with water. So that started our quest looking at hydroxyapatite. It's naturally occurring. It's what makes up the enamel in your teeth. It's calcium and phosphate. And so those opportunities kind of allowed us to create RiseWell and try and bring healthier, cleaner products to the oral healthcare space.
Well, that's fantastic. It's a really, really great story, and I think it's fantastic that you've helped your sister on this mission for finding a better products out there. And I think it's we just don't think that what we put on our toothbrush is actually going to have much effect on anything. But, a lot of our kids especially, they're swallowing a lot of the toothpaste, aren't they? So it's just as important as food.
You're darn right. Yeah, a lot of younger people have a hard time with their swallowing muscles, young adolescents, until they get to a certain age. So again, they're probably swallowing more than you think. And when we have better alternatives out there, why continue to use products that have unnecessary cleaners and detergents that you just don't want in your system?
Definitely. Now, can you explain the connection between oral health, gut health, and brain health? Especially in children with ADHD, we talk a lot about gut health here, a lot about brain health, but what's the connection with oral health?
Sure. So when you're looking at oral health, a couple of the mechanisms of action for how things get into the system, you're looking at inflammation. When you have a mouth that's not healthy, gums should be salmon pink in color. So if they're beet red and they bleed, that's not natural. You should be seeing your dentist for more frequent cleanings. That inflammation leads to gums that bleed easily. It's a portal for bacteria to get into your system. Again, it could be potentially exacerbating inflammation. So bacterial byproducts getting into the bloodstream through the gums. There's already been links of cardiovascular issues stemming from gingivitis and gums that bleed easily. And looking at folks with ADHD and some of the conditions they try and deal with the inability to sit still and attention and just being able to concentrate, they may have higher risks for poor oral hygiene, poor nutrition. Also, medications that they might be on could induce xerostomia. Xerostomia is a condition of dry mouth. When you have dry mouth, unfortunately, you're at a higher risk for decay because the saliva is very helpful and protective against decay. So no saliva, it creates a more acidic environment in the mouth, which is ripe for decay. And so really looking to help these young people with their oral hygiene, using clean products, keeping fermentable carbohydrates and sugars off their teeth. We're trying to give them a head start because you don't want your first visit to the dental office to be when you've got 4 cavities and a mouthful of decay. That really increases dental phobia and anxiety when it should be just a laid back, easy cleaning to really set these youngsters off onto a lifetime of good oral health and oral hygiene.
Yeah, that's fascinating. And, the fact that I can totally see how, if you've got that bleeding gums and that bacteria is growing, you're swallowing that constantly and, that's going down into your gut and that is creating that inflammation. We talk a lot here about how inflammation exacerbates ADHD symptoms because of that, real strong link between the gut and the brain. So you can totally see how all of that is connected.
Yeah, and you make a good point too, looking at the gut health axis as well with ADHD. And so there are studies to indicate that there are microbiome differences between folks with ADHD, looking at reduced levels of bifidobacterium and lactobacillus, which help regulate gut health, neurotransmitters, dysregulation of serotonin and dopamine can ensue when you have this dysbiosis of some of the natural gut microbiome that is available. Also, looking at conditions of inflammation in the gut could be leaky gut. So when you have leaky gut or your digestion is just not working properly, you could be getting inflammation to the brain that way. I mean, the vagus nerve is one of the modulators and helps connect the gut-brain axis, the vagus nerve. And so inflammation could be potentially affecting the brain. You look at food sensitivities, maybe exacerbating something in the youngster's diet here. So all by improving gut health, you might be able to help with your youngster's ADHD symptoms.
Yeah, and that's definitely one of the biggest topics that we talk about here. But you can see, what happens in your mouth goes to your gut, then goes to your brain. So it's definitely a fascinating link for sure. Now, what are some of the most common ingredients, found in traditional oral care products that we should definitely be avoiding?
Well, you make a good point. Look, we applaud everyone who's trying to help the oral health of people out there in the world. But look, I think a lot of the big box companies that exist, when you have 80+% of the market share, there's really not a whole lot of incentive to change what you're doing. And I understand the market and economic forces at play here. But folks they're out there, they're traditionally using sodium lauryl sulfate. So SLS, it's a foaming agent. It creates the suds and bubbles when you're brushing your teeth. And it kind of creates the illusion that something might be working better. But there's really nothing to suggest that is really helping with your oral health. If anything, it impairs fibroblasts. So fibroblasts are important in wound healing. So if you just had an extraction or a mouth surgery, you don't want sodium lauryl sulfate in your mouth. It's a detergent that impairs fibroblasts, slows down wound healing. Also, there are certain toothpastes out there that create sloughing. Have you ever seen like a thin layer of skin kind of peel off your mouth? There are certain products out there that I've noticed that it kind of creates like a harsh detergent type taste. And that sodium lauryl sulfate is just not something you want in your mouth with such a highly absorbent organ. Also looking at triclosan. Triclosan also, and it's in hand soaps. It's a detergent that's been banned in Europe. Some brands use that to help kill extra bacteria. And again, I think there was this shift in healthcare back in the day when sterility and killing all bacteria was the target to create this sterile environment. And, again, I applaud the efforts of those folks. And sure, if you have an acute infection, there's a time and a place for antibiotics. But for normal use, you don't want to be killing all the bacteria in your mouth. It's a balance between creating the good concentrations of the natural bacteria that is already present. You don't want to be sterilizing everything. Looking at ingredients like propylene glycol used in antifreeze, you really don't want these chemicals that are in there. They're irritants. They just inflame and irritate your soft tissues. Artificial dyes and sweeteners, don't need to be using those things. Alcohol is commonly or was commonly used in a lot of mouthwashes, again, under the premise of sterilizing everything, this kind of scorched earth policy that luckily through research, we've been able to decide that is potentially and probably not the best way to go moving forward. So using non-alcoholic mouth rinses because they just dry out your mouth too much. And again, we've kind of touched on fluoride where, again, we agree that fluoride works, but we just think there are better alternatives for people that have fluoride health concerns, like hydroxyapatite. Hydroxyapatite, naturally occurring, biomimetic, biocompatible, non-toxic, non-inflammatory. You don't get decay because you have a lack of fluoride. You get decay because you have fermentable carbohydrates producing the acids that lead to decay. Just keeping your teeth clean. You can use more healthy alternatives like a hydroxyapatite that don't have the deleterious health concerns that fluoride does.
Fantastic. Well, thank you for sharing all of those lists. I think listeners, what you want to do is you want to press pause right now. You want to rewind and you want to write down on a piece of paper all of those, toxic ingredients to look out for when you are purchasing your toothpaste for your children and for yourself. Now, you touched on fluoride a little bit there. There's been concern about the impact of fluoride on neurodevelopment, particularly in children. Can you share your thoughts on this and whether, there might be that link to that neurodevelopment or issues in the brain with that fluoride, and what really are the concerns around fluoride?
Yeah, so you make a great point here, and there definitely are some articles looking at the deleterious effects of fluoride. And again, some of these studies, it's really in science. Sometimes when you see a correlation, it doesn't always translate to a causation. So I want to just be sure to point that out to the listeners. But look, there are studies that potentially suggest that. The study out of Mexico is saying that higher levels of ADHD symptoms were found with mothers that had higher levels of fluoride in their urine. There are animal studies that show that higher levels of fluoride also led to some of the symptoms of ADHD. There was a Harvard meta-analysis study looking at 27 studies showing lower IQ with fluoride exposure. So, there are articles out there. It's definitely something to dive deeper in. I'd love to see the science that continue to come into this, but if there are questions around it, and if you're concerned about it, there are absolutely better alternatives out there, like hydroxyapatite. One of the mechanisms of action that people believe this potentially exacerbating ADHD symptoms is that fluoride is thought to cross the blood-brain barrier, leading to oxidative stress, potentially damaging neurons. So that's one of the potential mechanisms of action that's out there.
Well, it sounds like there's a lot out there, and there's this feeling. It's like with that traditional approach versus the more functional approach, the more natural approach. The peer-reviewed studies, are the gold standard. Unfortunately, a lot of those peer-reviewed studies out there, they cost a lot of money. And so, these big companies that hold 80% of the share of the market, and the pharmaceutical companies and the things like that, they do have the money to be able to fund a lot of these. But there's definitely that research out there, like you just shared, showing that, fluoride may be that toxic version that could be really affecting our children. So you touched on hydroxyapatite. Is it apatite, or how do you actually say it?
Yeah, hydroxyapatite.
Apatite. So it's like, yes, okay. Are there studies out there supporting the evidence around that? In bringing that in, and I'm sure you've dove deep into the research around that.
Yeah, there are. And it was kind of interesting too, because look, when you're going through dental school, a lot of the journey is just trying to graduate. Look, it's a stressful situation here. You're trying to get your requirements. Obviously, you want to become a good, competent, safe dentist, but you're just trying to make it through and survive. And so a lot of that is, unfortunately, sometimes you're not always asking critical questions because your curriculum is jam-packed. You're trying to survive and get to the next level and just graduate and start your career.
Totally. I'll say to that. And what you don't know, you don't know. It's like back in the day, I didn't know some things about that I know now in helping children thrive with ADHD. And, you go down this path and you are trying to graduate. You're doing a lot. I can't even imagine, going to dentistry school. I remember my dad, as I said, told me a few highlights here and there from back in the day. But I totally 100% understand that for sure.
Yeah, I love that too, and also looking at trying to question what's out there, and so questioning fluoride, that was kind of like questioning the Bible or something.
Yeah,
that people hold so deeply, and kind of like smoking back in the day, there was not this robust amount of evidence that smoking was obviously bad for you back when it was popular until the momentum slowly shifted, and it was discovered that it's probably not great for you. And so trying to question these things, it's been a journey for me. It was not something that came intuitively, because in the beginning I was kind of skeptical myself that, wait a minute, we had maybe in 4 years, one lecture on hydroxyapatite. It was in oral histology first year, just saying, oh yeah, that molecule, that technically makes up the shell of your enamel, but let's move on. So okay, well, I guess the teachers don't think it's important, so we're going to just try and graduate and get out of here. But, really looking at this journey that we've been on, talking to other folks, really diving into the research, realizing that, NASA, our space program here in the US, was one of the first entities to look at some of these molecules, because when astronauts were in a zero gravity environment, they were realizing that folks were losing minerals, losing bone density, and they wanted to try and help folks with some of these conditions, and also trying to brush your teeth without water in space, and trying to have something that was safe enough to swallow if you had to. And so they realized that hydroxyapatite could remineralize similar to fluoride without any of the health consequences. Wasn't a health concern if you swallowed it. And so for whatever reason, the powers that be kind of swept that under the rug here in the U.S. But the Japanese picked up on this research, and they've been starting using hydroxyapatite for decades in their oral care products. And it wasn't until we and a few others were kind of going over the research and discovering that, hey, this is a viable opportunity here in the U.S. market. I'm not sure why other companies hadn't really picked up on it, but we found a lane to offer something to consumers who are looking for other options.
That's fascinating. Look, if NASA thinks it's okay, then I think it's okay. No, that is really, really fascinating. It's fascinating that Japan have been using it for years as well. Now, that's one ingredient, obviously, that goes into the more natural toothpaste. What are some other natural ingredients in oral care that have been shown to be both like safe and effective, particularly for our children?
Yeah, so and I think when you're looking at other ingredients, xylitol, it's a naturally derived corn-based sweetener that is really wonderful in the oral environment because yes, it is a sugar alcohol, but it is an ingredient that the bacteria that traditionally make decay. Strep mutans, type of bacteria, it consumes glucose, sucrose, produces acids. These acids actually weaken the tooth, cause chips in the enamel, leading to the hole or decay that you commonly see. Xylitol cannot be metabolized by the bacteria. It interferes with their ability to metabolize it, leading to bacteriostatic situations where the bacteria just don't function properly, don't produce the acids, don't produce decay. So xylitol has been shown to be a really great opportunity to use in oral care products because it arrests this decay-causing process. So we use it in our mouth rinse, we use it in our toothpaste. There are chewing gums that have it. Again, you don't want to feed it to pets because pets and dogs are super sensitive to this type of sugar. But for human use, it's a sugar alcohol. You might get some GI upset or distress if you're a sensitive person to it. But for most folks, it's been shown to be super helpful in combating decay and arresting the bacteria that cause the acids.
Fascinating because, I've heard of xylitol a lot, obviously in, as a natural sugar alternative in food. And so I didn't realize that it actually has some real benefits in keeping that bacteria at bay in the mouth. Now, we get questions all the time from families that we're working with and families in our community on how they find a dentist. Because, when you go to the dentist, they use a lot of these products that they're taught to use that have these artificial ingredients, these artificial flavors, these artificial colors. What are some key questions parents should ask when choosing a dentist, who embraces a more natural approach, really to ensure that their child's oral care supports their overall health goals?
So it's a great point. I think nowadays we have so much information available to us that we did not have in the past. I think in the past it was pretty much just the yellow pages. Like, does your person have an ad in the yellow pages? That's all we had access to. But now people can have social media pages. They can have websites. They can have a whole host of media front pages of customer facing opportunities on the internet. So I would check their resources. You can kind of get a vibe and style for your dentist just by their social media, by their website presence. And a lot of dentists, too, they're open to just kind of touring the office and meeting them before you officially become a new patient of record and maybe asking the dentist point blank, like, are you okay with fluoride alternatives? What materials do you use to fill teeth? And I think these will give you key insights into how open-minded they are, or on what spectrum of the naturalistic type dentist are they versus conventional type medicine. And look, I still practice mostly conventional type dental medicine. I don't use amalgam or mercury fillings. I promote hydroxyapatite instead of fluoride, but there are certain things that I learned conventionally that I use that I feel are appropriate. So it is a spectrum and kind of what you're comfortable with. But I think having open and honest dialogue with your provider will give you key insight into seeing if they're a good fit for your family or not.
Yeah, definitely. That's some really great advice for listeners out there. I was actually really surprised to see that metal fillings were still used in the US when I got here. They sort of been banned in Australia for years and years and years. And so I was actually really fascinated to see that they were still used, but it's great that you can find dentists that don't use those.
Absolutely.
Yeah, for sure. Well, Dr. Derek Gatta, thank you so much for joining us, sharing your wisdom, sharing what parents should look out for when really trying to support their child's overall health well-being, along with that oral care, sharing your knowledge, sharing your experience with all our listeners. Please tell listeners where they can find and follow you online.
Certainly. So again, thank you for having me. And you can find me at Dr. Derek Gatta on Instagram. My practice is Innovative Dental Aesthetics here in Boca Raton, Florida. And of course, risewell.com. You can check out our products and see how they resonate with you and your family. But we're getting a great response across the country. And I think you'll enjoy them. So thank you for the opportunity.
Fantastic. Thank you once again for joining me. And listeners, we will drop some links to some of our products that we love here at the ADHD Thrive Institute or on the Soaring Child podcast in the show notes below. Listeners, thank you for tuning into this week's episode of the Soaring Child. I'm Dana Kate, your ADHD health practitioner. Keep on thriving. Thank you for listening to the Soaring Child podcast today. To learn more about how to help your child with ADHD soar using natural strategies, visit our website at adhdthriveinstitute.com and follow us on social media at ADHD Thrive Institute.